compete against each other. You will be competing against the computer for scoring more than 200. ओके, अब की बार 200 पार. अब तो लोग 250 भी टच कर रहे हैं. ऑलराइट, सो फर्स्ट थिंग, थैंक यू, good great God above, that I was given an opportunity to learn while teaching and teach while learning. Orthopedics as a branch means straight child. First question, coined by Nicholas Andre. H.O. Thomas, a very important scientist, Thomas splint. This is a Thomas splint which was given for TB of the knee joint. In today's world, it is used for stabilization of the shaft of femur. Also remember, he gave a Thomas test for flexion deformity of the hip joint. That is called as Thomas test. Most joint replaced in the human body. The most common joint placed in the human body is knee joint. It is also the largest joint. And the father of replacement is Chanlis. Arth means joint. Plasty means replacement. Okay. Next, when I look at X-rays, वॉइस अटक अटक के आ रही है. आप ये निकाल दो बेटा, इसको निकाल दो. गुरुजी, वॉल्यूम इंक्रीज. आई मैक माइक्रोफोन को ना ये कोई नहीं यार, किसी को दुखी नहीं करना यार. जो कर सकते हैं वो कर लेते हैं. सेरेबेलम में मिल जाएगा, सेरेबेलम के यूट्यूब चैनल में. ऑलराइट, एक्सरेज कैन शो यू एवरीथिंग, बट व्हाट इट कांट शो यू इज द कार्टिलेज. एक्सरेज कार्टिलेज नहीं दिखाता. ऑर्थोपेडिक्स में if you want to see the calcification or the cortex, उसकी investigation is CT scan. But if you want to choose one radiological investigation which will practically show you everything including the cartilage, it is MRI. MRI को मारो. Number one investigation for orthopedics, radiological investigation. तो कुछ समझ ना आए, right? That is MRI. When I look at tumors, you want to prove it's a tumor, then you have to see a tumor cell on biopsy. If you want to prove it's an infection, you need to grow the organism on culture. So टुकड़े की जांच सबका बाप. Most important is biopsy. B for biopsy, B for best. Common things पूछी जाती हैं बेटा, जैसे most important investigation MRI है. If you answer the common things, you are commonly selected. जो रेयर आंसर मार्क करेगा वो रेयरली सिलेक्ट होगा. कहते हैं जो आया है वही आएगा, जब हमको समझ आएगा तब हमारा नंबर आएगा. ओके बेटे, राइट. सेरेबेलम में भी तो मिल रहा है ना बेटा. मेटास्टेसिस, पेट स्कैन इज द इन्वेस्टिगेशन ऑफ चॉइस. पेट स्कैन more than bone scan. PET scan will pick up mets all over the body. So MRI एक एरिया में, but PET scan all over the body can pick up the metastasis, but not for osteoblastic mets. Osteoblastic mets are picked up on bone scan. B for bone scan, B for blastic activity. That's how it goes. When you have any disease, it will destroy the bone. Then the bone will shout as periosteal reaction. Periosteal reaction means that the bone is getting destroyed. Now, when you have a single periosteal reaction, that's a solid periosteal reaction seen in osteomyelitis. They don't ask you that. They usually show you these type of beautiful names. Sun ray appearance, सूरज की किरणें, can be seen in any malignant lesion, can be seen in any chronic infection, but usually osteosarcoma. Osteosarcoma. Why I said can be seen any malignant lesion or any chronic infection? Because if you want to prove a tumor, periosteal reaction will not prove a tumor. It is the biopsy which will prove a tumor. Similarly, the periosteum lifted up, a triangular piece of bone underneath, Codman's triangle, again osteosarcoma. And last, when you have multiple layers of periosteum over the bone, it is called as onion peel appearance, seen in Ewing's sarcoma. So these are something that you should remember. All these are MCQs that are asked you. Osteomyelitis, that is bone infection. The king of osteomyelitis, the most important organism is Staph aureus. Remember, most important area where you see osteomyelitis is metaphysis. And it comes to the blood, hematogenous. The most common part of the body where you see osteomyelitis is lower end of femur. So on osteomyelitis, MRI can pick the changes earlier. But पहले तो एक्सरे कराएंगे ना, because orthopedics में पहली investigation एक्सरे होती है. Then you do an MRI. If you want to prove infection, culture sensitivity. This is what I just told you. If there is SCA, that is sickle cell anemia, Salmonella is the most common organism. That's what you need to remember. Chronic osteomyelitis is diagnosed by a dead bone. Again, the most common area for chronic osteomyelitis is again lower end femur. If you remove the dead bone, the bleeding bone comes, called as paprika sign, seen in chronic infections, chronic osteomyelitis. Remember, this is a bone nibbler. A very, very important instrument that is asked you in the exams. Acute osteomyelitis turns into chronic osteomyelitis, the organism again will stay as Staph aureus. So multifocal osteomyelitis means going to different parts of the body. It has a nomenclature called the Safo syndrome, which means synovial proliferation, skin lesions of acne, skin lesions of pustulosis, bone thickness, which is called as hyperostosis, and bone inflammation called as osteitis. So it's multiple bone involvement. It's called as multifocal osteomyelitis, right? It's an autoimmune disorder which is HLA-B27 positive. That is why disease-modifying drugs are chosen. And the second is sickle cell anemia, where Salmonella is the organism. Again, here the multiple bones are involved. You know, such an interesting thing to remember that Safo syndrome is a misnomer. Infection nahi hai. And when it comes to HLA-B27 positive, remember, young man, low backache, reduced chest expansion, decreased lumbar movements, red eye, heel pain, bamboo spine. What is it? Very good. HLA-B27, ankylosing spondylitis. ये नींद में भी आना चाहिए. Young female, bilateral hand pain, morning stiffness. Come on. Young female, bilateral hand pain, RA, rheumatoid arthritis. All right, that's important. Now, in lower limbs, if there is a joint infection, right, infection of the joint, of the hip joint, there will be a position of flexion, abduction, externalization called as Faber. This position is, right, is something that you see in synovial proliferation, hip dislocation anteriorly. Normally it goes posteriorly, but if hip dislocates anteriorly, or iliotibial band contracture, which are seen in polio. This is a position where the limb lengthens. There is lengthening. So synovitis, infections of the joint, anterior dislocation, iliotibial band contraction. It's opposite, right? Right? This is anterior dislocation. So head has gone anterior, down. Whenever there is an anterior dislocation of the hip or the shoulder, the head is below the level of joint and thigh or arm is abducted. So इसे कहते हैं down and out. Down and out. All right, down and out. All right, and there's always lengthening. Whereas flexion, adduction, interrotation, it is seen in hip dislocations or arthritis of the joint. Here, you will always have shortening. Which dislocation is more common, beta, in the hip? Posterior dislocation. All right, so remember that. So Faber, anterior dislocation, Fadil, posterior dislocation. All right, Posterior dislocation damages which nerve? The sciatic nerve. All right. So Faber, anterior lengthening down and out. Posterior, right? Farther up and in. The head is up and in. When I look at joint and there is flexion, abduction, right? And externalization of the hip joint. Faber position. तो या तो साइनोवाइटिस हो सकता है या इन्फेक्शन हो सकता है. If 0 to 5 years, toxic child, not eating, fever, high grade points, ESR high, CRP high, and the movements are absent, it's called as septic arthritis. Organism is Staph aureus. The order of investigation, the first is X-ray, then is MRI, then is aspiration. And aspiration is always done USG guided. Right? Surgery is open the joint and drain it. Arthrotomy plus antibiotic for 6 weeks. Whenever you have a joint infection, you cannot wait. You need to operate because it will damage the cartilage. Whereas age group 6 to 12 years, non-toxic child, decreased movement, same Faber with lengthening. All right, there will always be lengthening. It is transient synovitis. Order of investigation same. X-ray, MRI, aspiration, but treatment is just rare because it's transient. It will disappear with time. Temporary proliferation. All right. So it is self-resolving condition. All right. Hand infection. Most common hand infection is the infection of the nail bed called as paronychia. Organism is Staph aureus. All right. If there's an infection of pulse space of finger, it's called as Fallon or Whitlow. Organism is again Staph aureus. All right. When I look at tuberculosis, remember TB in India is something which is very commonly asked, and it will always involve two joints. It is paradiscal involvement. It is anterior to the spinal cord. So TB will never involve single vertebra. It will involve one vertebra above, one vertebra below the disc. All right. If there is weakness in TB, so first of all, there will be motor weakness, then the sensory loss, and Bava blood involvement is the last. TB spine is treated with Medipath regimen. It means initially start with ATT, right? Then rest to the patient. If required, then you will operate. This is given by Dr. S.M. Tuli, sir, Professor S.M. Tuli, sir. All right, my teacher. The most important TB drug is rifampicin. When do you operate? If there is increased weakness or sensory loss, means it worsens. When it's not improving, no improvement. When there is bowel, bladder involvement, then you need to operate it. All right. So this is the surgery. Spine. When there is infection of spine or lesion of spine, it will show you loss of curvature of the spine earlier than the reduced disc space. When there is hip or knee, because more vascularity will be there in infections, it's called as periarticular osteopenia. TB knee, all right, TB knee will have initially flexion deformity. But then it will have three components remembered by this mnemonic of PERF: posterior subluxation of tibia, externalization of leg, and flexion of the knee. This is triple deformity. Triple deformity is not only seen in TB, it is also seen in rheumatoid arthritis. Remember this, my friend. TB hip is more commonly asked. Stage 1 TB hip, this is synovial proliferation. Synovitis होगा तो फेबर होगा. फेबर होगा तो लेंथनिंग होगा, गुड प्रोग्नोसिस. मैक्सिमम क्वेश्चन स्टेज 1 से आते हैं. When the TB infection will increase, it will damage the cartilage, there will be arthritis. So there will be farther and there will be less than 1 centimeter shortening. In stage 3 or advanced arthritis, there is more than 1 centimeter shortening. Remember one thing, अगर क्वेश्चन में लिखा है a patient has got TB hip with shortening, आप stage 3 मार्क करेंगे. Because less than 1 centimeter shortening is impossible to identify. बहुत मुश्किल है, इतना एरर तो वैसे ही हो जाता है. So you will, and these questions have come. So you will mark it as late or advanced arthritis. Stage 4, femoral head is destroyed, acetabulum is destroyed. The destroyed head migrates in the acetabulum called as wandering femoral head or wandering acetabulum. And stage 5, there is fusion of the joint, which is fibrous. And remember, fibrous fusions are always painful. All right. So it is joint destroy हो गया, fuse हो गया और painful रह गया. All right. So it is fibrous fusion. You don't have to, Dr. Wolf. Let's forget about the X-rays. They will not be coming to you. All right. Arthrodesis. If there's a joint damage, the best thing to do is you operate it and replace it. That's called as arthroplasty. But in infections, it's very difficult. All right. So you do a fusion. That's called as surgical fusion. When a surgeon fuses a joint, he'll make sure it's a bony fusion and there is no pain there, painless. Whereas ankylosis is a pathological fusion, a disease fuses a joint. As discussed, fibrous fusion will always be painful. It will be seen in tuberculosis of the peripheral joint and in rheumatoid arthritis. Whereas bony is solid. S for solid, S for septic, S for spine TB, S for ankylosing spondylitis. So it is a painless fusion. Bone to bone fusion, no pain. No movement, no pain. Ankylosing spondylitis, young male, low backache, reduced chest expansion, decreased lumbar movements, heel pain, eye pain, morning stiffness, HLA pontificative, bamboo spine. It fused like a bamboo. This is ankylosing spondylitis. Question आता है. Excuse me. Rheumatoid arthritis, bilateral hand pain, morning stiffness, right, is RA. Young female or middle-aged female. Benign tumors, they will always have well-defined margins. And whenever you will touch it, it will have uniform feel. Bone से है तो hard होगा, cartilage से है तो firm होगा, soft tissue just soft होगा. Whereas malignant tumor will be somewhere hard, somewhere soft, somewhere firm. That is ill-defined margins and variable consistency. Remember, when you want to diagnose the tumor, there are key points. And FMG के एग्जाम में these key points ही आते हैं. Benign tumors की खासियत है single central cavity, right? Single central cavity. Upper end of humerus is unicameral bone cyst. And there will be a haddi ka tukda in it, fallen leaf sign. Number one. Multiloculated eccentric, multiple gadde filled with blood fluid, aneurysmal bone cyst. Both are in the metaphytes. UBC, ABC. A bony growth, right, which is causing a night pain in the cortex of the bone. Diaphyseal lesion. Most of the lesions are metaphyseal. Right? Night pain relieved on taking salicylates or aspirin. 2015 में तो ये question आया था that the patient had right a lesion which had night pain and it got disappeared on taking aspirin. That is osteoid osteoma. All right. So this is the lesion of the diaphyses. Okay, and this is the only lesion where you do a CT scan. The other lesion which are seen in diaphyses are Ewing sarcoma or adamantinoma. So all of them start with vowels A, E, I, O, U. All right. Next, if you have a lesion which is large to feel, आपने छुआ, you will feel the bone, you will feel the cartilage, but small on X-ray. So it's a bone covered by cartilage. It's called as osteochondroma. So the lesion size is more than 2 centimeters. If on MRI, it means that the malignant transformation has occurred. So what is more than 2 centimeters? Cartilage thickness. Because cartilage cannot be seen on X-rays, cannot be seen on CT scan. So if the cartilage thickness is more than 2 centimeters on MRI, this is malignant transformation. This is osteo, means bone covered by cartilage, chondroma. It always grows away from the joint. It keeps on growing till the child grows, the skeletal maturity. Skeletal maturity को याद कर लेते हैं. 18 years, the shoulder area keeps moving, it keeps growing. 16 years, the elbow keeps growing, fusion. And 18 years at the wrist. So 18, 16, 18. So knee is 18 years. So hip and ankle is 16. याद करने का तरीका, जब एक बच्चा गांव में बड़ा होता है तो माँ बाप कहते हैं अपने कंधों पे घर का बोझ उठाओ, अपने घुटनों पर खड़े हो जाओ. So take the responsibility of the family on the shoulders and stand on your knees, 18 years. So shoulder and knees 18 years. So 18, 16, 18 alternate. Since knee is 18 to 16, 18, 16, the way to remember. All right. Epiphyseal lesion with calcification. If some lesion is having calcification, that's chondroblastoma, also called as Codman's tumor. again seen before skeletal maturity. Which age is for the shoulder? What age is skeletal maturity of shoulder, my friends? We just did 18 years. Very good. So 18 से पहले होगा. Also, there will be calcification. All right. It is also called as Codman's tumor. Codman's triangle was a periosteal reaction seen in osteosarcoma. Codman's tumor is seen in chondroblastoma. Most common tumor of bones of hand and feet and chondroma. And on biopsy, you will see hyaline cartilage. आपको hyaline cartilage मिलेगा. All right. Now, this is the king of orthopedics. If investigation में MRI, if organism में Staph aureus, then bone tumor में giant cell tumor. The tumor that can go till the joint is the giant. There is no other tumor which can go till the joint. So giant cell tumor. Classically can be seen in the lower end of radius. So tumor of the lower end of radius is GCT till proved otherwise. It's going till the end. Epiphysio, metaphysio. Age group is 20 to 40. It has a mononuclear cells, which are malignant cells, and giant cells, which gives it the name. It is treated by extended curettage. Means you do a curettage, means take out the contents and add some chemical to it, like phenol, liquid nitrogen. All right. So this is called as extended curettage. Same for same for aneurysmal bone cyst, extended curettage. Same for chondroblastoma, extended curettage. Same for enchondroma, extended curettage. All right. And then it can be seen in upper end of tibia or in the upper end of femur. But the commonest lesion where you see this is the lower end of femur. So lower end of femur, you see osteomyelitis, and the lower end of femur, you see giant cell tumor. So when you have curettage, it is for simple bone cyst or unicameral bone cyst or solitary bone cyst. They all mean the same, single cavity. Unicamera, single cavity. Extended curettage, either you put phenol or liquid nitrogen. Phenol is the most common one. Liquid nitrogen is the best one. For aneurysmal bone cyst, chondroblastoma, giant cell tumor, and chondroma. So remember, this is very, very important page. All right. Bone tumors are more common in males than females. For example, जब बीमारियां बटी तो पहला मिला RA females, ankylosing spondylitis males, bone tumors सारे males, दो bone tumors females, GF girlfriend, G for GCT, F for fibrous dysplasia. And in fibrous dysplasia, the upper end of femur looks like a shepherd crook, called as shepherd crook deformity. Remember that. Here, the hazy appearance of the bone is there, called as ground glass appearance. Both are MCQs. All right. Also, upper end of femur in this is called as Rindsheim. Remember, there's a syndrome here called as McEwen-Elbright syndrome, which has got polyostotic, means multiple bones, fibrous dysplasia, precocious puberty, and pigmentation. All right. This is what you should remember. Multiple enchondromas को Olliers बोलते हैं. Enchondromas with hemangiomas with calcified veins को माफूसी बोलते हैं. And McEwen-Elbright fibrous dysplasia with precocious puberty with pigmentation. Histiocytes, when they destroy a bone, is called as histiocytosis. When it destroys the entire skeleton, is Letter-Sway disease. When you do a biopsy of a histiocytic lesion, it has a granules which has tennis racket appearance. And here, one of the histiocytic proliferation is eosinophilic granuloma, which is a solitary lesion in the bone. Usually the skull. It is self-resolving. And in medical science, whatever is self-resolving beta is an MCQ. So Letter-Sway disease is fatal. Hand-Schiller-Christian disease is lytic lesions with eye lesions with diabetes. But single lesions are eosinophilic granuloma. They have beveled lesion. आपको beveled पता क्या होता है? Slope, ढलान. Okay, beveled lesion. So it is a slope in the skull. All right. First decade means 1 to 10 years. Onion peel appearance, diaphyseal lesion, Ewing sarcoma. यहाँ पर एक love triangle है. Love triangle है that first decade को Ewings पसंद है. But Ewing's को second decade पसंद है. Means if there are 10 tumors in the first decade, majority will be Ewing's. But 90% of Ewing's are in the second decade. So Ewing sarcoma second decade is more number of tumors than first. Second decade का राजा कौन है? Osteosarcoma 10,000 20,000 ट्यूमर में, राइट. मेटाफाइजल प्लस कॉर्मेंस ट्राइंगल और सनरेपेनल ऑस्टियोसार्कोमा राजा है आपके एमसीक्यू उसका. ऑलराइट. इसे रेडिएशन इंड्यूस्ड ट्यूमर भी कहते हैं. रेडियोथेरेपी दी 10 to 15 ईयर्स बाद यू सी अ लीजन. सो इविंग्स second decade more than first. Giant cell tumor again second love triangle, right. Lower end radius, right. GCT is still proved otherwise, but the most common location is lower end femur. So lower end radius को GCT पसंद है, but GCT की most common location lower end femur है, right. Third, ameloblastoma का most common location is mandible, but mandible का most common tumor is squamous cell carcinoma. All right, so these are three love triangles that you must remember. All right, metastasis to the bone, they usually come from the breast. Prostate, when they come from prostate, they are osteoblastic or neck, and they usually go in the thoracic spine. All right, skull में multiple lytic lesions are seen in a tumor which has got destruction of the bone only, plasma cells called as multiple myeloma. These are called as punched out lesions. When you have beveled or sloping edges, it's eosinophilic granuloma. When you have large multiple lesions, it's permeative lesions seen in histiocytosis. छोटे छोटे dot, salt pepper appearance seen in hyperparathyroidism. Remember, increased calcium levels body में in orthopedics दो condition में होते हैं, multiple myeloma and primary hyperparathyroidism. Increased calcium levels are not seen anywhere else. These are two areas where you see increased calcium levels. In trauma, remember airway, breathing, circulation, but stabilize the cervical spine first. When there's a nerve injury, if somebody goes and says, doctor, I slept by the arm and I have a wrist drop, इसे कहते हैं न्यूरोप्रेक्सिया और Saturn night palsy or crutch palsy. It will come back like magic, 100% recovery. All right. If there is recovery from proximal to distal, इसे बोलते हैं axonotmesis. Tinal sign is positive, which is a sign of recovery, and it should recover by 1 millimeters per day. And when there's a complete nerve transaction, there's no recovery without surgery. It's called as neurotmesis. Remember, it's very important for everybody to remember that around shoulder is axis nerve, and it gives a sensory area here called as regimental Bass sign. Around the shaft of humerus is radial nerve, which causes wrist drop and sensory loss on the dorsum of the first web space. Behind the medial epicondyle, this is loved in FMGE exam, is ulnar nerve, which causes claw hand. Claw hand means ulnar nerve and medial nerve, they supply the lumbricals, which cause flexion of MCP and extension of interphalangeal. Their paralysis causes claw hand. Hyperextension of MCP and flexion of interphalangeal. All right, so ulnar nerve, right? Around the head of radius is posterior nerve, which causes finger drop, loss of finger extension. All right. Around the wrist is median nerve, which again can cause claw hand. Best test for nerve recovery is electromyography. For the sensory supply, the index finger is median nerve. The little finger is ulnar nerve. All right. And the dorsum of the first space is radial nerve. In human body, radial nerve is the most commonly damaged nerve. और जो कॉमन होता है उसका प्रोग्नोसिस भी अच्छा होता है. इट हैज द बेस्ट प्रोग्नोसिस. आई टोल्ड यू एक्सिस नर्व रेजिमेंटल पैच एरिया, रेडियल नर्व wrist drop, ulnar nerve claw hand, and when you have a claw hand and you want to correct, you will give a knuckle bender splint. Knuckles को bend करने वाला splint. Posterior tortious nerve finger drop and sensory loss in the radial nerve. In the lower limb, sciatic nerve is damaged around the hip joint. Will cause complete loss of all the movements in the limb. Around the knee, right, you have common peroneal nerve, which will have high stepping gait or foot draw. All right. Remember that whenever you have a wrist drop, you will give a cock-up splint. We'll just come to it. Ulnar nerve supplies the palmar and dorsal interosseous, right? And if you give a card to a patient and ask him to hold a card between the, ये देवी माँ का सिक्का है. You ask him to hold a card between the fingers, this palmar interosseous. Palmar, adduct, pad. Dorsal interosseous, the abduct. So it moves out. All right. This is Igawa test. I for Igawa test. Right. Now book test. You give a book to a patient and ask him to hold a book. Show off nahi kar raha. If you ask him to hold a book between the thumb and palm, this is book test. If your ulnar nerve is paralyzed, you will flex the thumb and hold the book. This is called as Froment sign. Remembered by the mnemonic FU. Froment sign is for ulnar nerve. All right. Then abducted little finger is called as Wartenberg sign. Again, ulnar nerve. ये ulnar nerve के test हुए. If you ask the patient to make a fist and his fingers stand out, this is called as pointing index or Ochsner clasp test. This is how the Pope talks, also called as benediction attitude. The flexion of first two fingers is controlled by the median nerve. Also remember, if you ask a patient to hold a pen above the palm and touch it, this is pen test, again median nerve. Median nerve is supposed to do opposition. If median nerve is paralyzed, thumb will be in the same plane as palm, called as ape thumb deformity. So this is the action of lumbricals, and the paralysis is called as claw hand, knuckle bender splint, senior ulnar more than median nerve. The compression neuropathies. The most common compression neuropathy is compression of a nerve in a closed space is around the carpal tunnel, the median nerve. The lateral 3.5 fingers tingling, रात को झटका देके आराम, more common in females. All right, and these type of syndromes, right? The best test is Durkan's direct compression test. You can have tunnel sign being positive. You have nerve conduction velocity to be done. There are a lot of tests, but Durkan's direct test is the most important. The Fallon's test or Ulta Namaste or reverse Fallon's test, the Sida Namaste are for the carpal tunnel syndrome, the most common compression neuropathy. When there is compression of lateral cranial nerve of thigh, the L2 nerve roots, it is called as meralgia paresthetica. When there is compression of the sensory supply of radial nerve, superficial radial nerve is called as cheralgia paresthetica. When there is sciatic nerve compression around the hip, it's called as piriformis syndrome. When there is T1 and C8 nerve roots compression around the neck, it's thoracic outlet syndrome, and there are tests for it. Addison's test, the Wright's test, and the Roos test. All right. So T1 and C8 nerve roots. And Allen's test is for the patency of the radial nerve artery before cannulation. Penn test is for median nerve. Okay, E85 fuel, what a name. All right. When you come to trauma, okay, let's come to trauma and understand that shoulder is the most common joint to dislocate. It goes anteriorly because head बहुत बड़ा है. All right, or glenoid is very, very small. In anterior dislocations of the hip or shoulder, the head comes down and the arms goes out. We did that at the beginning. In posterior dislocations, it goes up and in. All right. Shoulder dislocates anteriorly. All other joints, they go posteriorly. The test for shoulder dislocation are Dugar's test. Opposite shoulder को नहीं छू सकते आप. Callaway test. The circumference of the axilla increases. The ruler test. Normally, a ruler, if you place on the lateral epicondyle of humerus, will never touch the acromion. But if it is dislocated, it can touch. Or a Bryant's test. Vertical height of the axilla is increased. Maneuvers to reduce is Kocher's maneuver, give traction, external rotation, ADD adduction, middle rotation. Dugas is for shoulder dislocation, beta. They are all for shoulder dislocation. Right? We are doing beta orthopedics. We are in cerebellum, and we are learning trauma, and we are doing shoulder dislocation test for that. Okay, beta. All right. Stimson's is gravity assisted, not to be done. Hippocrates तो जल्लादों वाला काम है, करना ही नहीं चाहिए. Posterior dislocation, up and in. The joint is up. It is the most common misdislocation in human body. If there is a posterior dislocation, then you will think about the history of epilepsy or electric shock. In this condition, the head looks like an electric bulb sign or a light bulb sign, and it looks like an empty glenoid. It is the most common misdislocation in human body. The rotator cuff muscles, supraspinatus, infraspinatus, teres minor, They insert on greater tuberosity, and subscapularis inserts on lesser tuberosity. The rotator cuff muscles are responsible for abduction externodation, but subscapularis is for internodation. And the test for it is called as the lift-off test. The subscapularis is also called as the forgotten tendon of rotator cuff. The rotator cuff tendons are repaired in young individuals. Clavicle is the most common bone to fracture. It fractures at the middle one third, and it's called as figure of eight bandage for it. This we have done shoulder axillary nerve, humerus radial nerve, and at the junction of middle one third, lower one third called as Halston lowest side. Around the medial epicondyle ulnar nerve, around the head of radius posterior interosseous nerve causing finger drop, around the hip the sciatic, around the knee the compral nerve causing foot drop, most commonly asked question. Remember, when you have a fracture of supracondylar humerus, that's above the condyles, it will cause cubitus varus, means distal part towards the midline. If there's a fracture of lateral condylar humerus, it will cause cubitus valgus, distal part away from the midline. Valgus में L आता है, so the distal part goes lateral. कुछ लोग रम और गम भी याद करते हैं, मैं तो L से lateral याद करता हूँ. All right, supracondylar humerus. The most common nerve involved is anterior interosseous nerve, which is a branch of median nerve. Then the median nerve, then the radial nerve, then the ulnar nerve. In lateral condyle humerus, there is cubitus valgus. धीरे धीरे valgus जाएगा. So behind the medial epicondylar nerve will be stretched. Which nerve is there behind the medial epicondyle? Ulnar nerve, called as slow onset ulnar nerve palsy, tardy ulnar nerve palsy. All right. When there is a joint damage, movement नहीं होगा. If there is a muscle or joint के ऊपर damage, you can't move yourself. When you move yourself, it's active movement. When somebody else moves your joint, passive movement. So if there's any damage to you, you can't move. So active movements are gone every time. But in joint damage, passive, you can't move it because movements occur at joint. All right. Elbow dislocation most commonly occurs posteriorly. Is the most common dislocation in child and ulnar nerve is involved. Remember, whenever there is trauma, we need to remember four things. यहीं पे question आता है, that's an area. C for compartment syndrome. C for cast. If there's a tight cast applied to a patient, his microcirculation gets blocked. He comes crying to you. First thing is you remove the cast. Pain will be so out of proportion to the problem. उसको आराम आएगा ही नहीं, चाहे दवाई दे दो, कुछ भी कर लो. The moment you stretch the distal most joint, they will be crying. This is compartment syndrome, and treatment is fish shortening. If there is an injury around elbow, and parents take the child to a Pehlwan, and he did a massage, there will be a bony formation in the muscle of brachialis or biceps called as myositis. The movements are limited. Give rest to the patient. If there is a Colles fracture, it has united, and after that, red hot shiny skin, osteopenia occurs. That is Sudex, means sympathetic overactivity. If there is a femur fracture, after 48 hours, there is breathlessness, confusion, and petechiae. That's fat embolism. Everything is bad here. Fat embolism is worst. C for compartment syndrome, C for cast. M for myositis, कर दी massage. S for Sudex, हो गई sympathetic overactivity. F for femur fracture, करके जाएगा fat embolism. CC, MM, SS, FF. Compartment syndrome usually occurs in the tibia. Myositis around the elbow, brachialis. Sudex, there is sympathetic overactivity in the Colles fracture, and embolism, femur fracture. When there is a fracture of the distal end of radius, which is away from the joint, extra-articular, is a Colles scan. Mnemonic is Priyanka Chopra, posterior जाता है, and when it malunites, अगर ढंग से जुड़ेगा नहीं, it causes dinner fork deformity. Colles fracture की एक कॉम्प्लिकेशन हमने पढ़ी Sudex, but वो सबसे कॉमन नहीं है. ये हमने पढ़ी डिनर फॉक डिफॉर्मिटी इज वेरी कॉमन, बट कॉमनेस्ट क्या है कोलीज की प्रॉब्लम? फिंगर स्टिफनेस. स्मिथ इज अपोजिट ऑफ कोलीज. ये हमारा जॉइंट है. दिस इज अवर फर्स्ट मेटाकार्पल. फर्स्ट मेटाकार्पल is always anterior to the joint wrist. So it causes anterior. So Anushka Sharma, anterior displacement is Smith. It causes garden space deformity. When there's a joint damage, if there is a damage of articular steroid, this is the styloid, that's called as radial styloid fracture. It's called as Schoffer's fracture. And when there's a joint damage and there is a wrist movement with it, it's called as a Barton fracture. When there's a fracture of the base of first metacarpal, they just love to ask you, अगर सिर्फ चूरा हो गया, that's Rolando. And when with a fracture there's a dislocation, that's Bennett's. All right. When there's a fracture of ulna with dislocation of radial head, which can damage posterior and dorsal nerve, it's Montague. When there's a fracture of radius with damage to the distal radioulnar joint is Galeazzi. Galeazzi is more common. Both are asked. So Rolando, Bennett, Galeazzi, Montagia, Schoffers, Coley's and Smith. ये आपको नींद में आना चाहिए. All right. If you look at the terminal, एक और आता है. When the एक father एक बच्चे को लेके आया. The child is crying. Age is 3 years. Forearm is pronated, right? And the clinician immediately sees and supinates it, called as pulled elbow, very commonly asked. So if this is the end of the spinal cord called as conus medullaris, and these are the nerve roots, right? If these nerve roots are damaged, it's called as cauda-equina syndrome, which is asymmetric. When the terminal end of neural tissue is damaged, it's called as conus medullaris symmetry. And when initially there is damage and there is no motor sensory fibers, that's complete loss. Spinal shock, and the first to recover is bulbocavernosus. I can repeat anything you want. Barton's is a fracture of the joint with subluxation. So Barton's और Coley's में फर्क क्या? Coley's is extra articular area, and Barton's Pasonhai, पास होना है, Pasonhai. Sorry, pass होना है to everyone is intra-articular of the same area. अलग ही लेवल हूं मैं भी, तुम भी अलग हो, मैं भी अलग. So Jefferson is a fracture, right, of the C1 vertebra, the ring fracture, atlas. Hangman is fracture of C2 vertebra. C2 slips over C3. All right. It is called as, right, spondylo means vertebra ka slip hona, spondylolisthesis. If you're going in a high-speed vehicle and your spine, right, goes into hyperextension followed by flexion, that's whiplash injury. When the skull base divides into two parts, that's hinge fracture or motorcycle fracture. और जब आपको एक्सरे पे कुछ मिले ही ना बच्चों के अंदर, that's called as spinal cord injury without obvious radiological abnormality. Skybora, interesting name. When you look at the curvature of spine, cervical spine अंदर जाता है, called as lordosis. Thoracic बाहर आता है, kyphosis. Lumbar goes in, lumbar lordosis. Most common question आता है, what is the normal curvature of lumbar spine? Lordosis. When there is lateral curvature of spine with rotation, again an FMGE question, scoliosis. Measuring scoliosis is by Cobb's angle, and कितना वर्सन करेगा, you come to know by riser sign. Whiplash injury usually goes into the cervical spine. Okay, Nikhil? So Cobb's angle is to measure the degree of scoliosis, riser sign, prognosis of scoliosis, progress of scoliosis. If there is idiopathic scoliosis, means you are not able to find out any cause. You ask the patient to bend forward, गायब नहीं होगा. If there is congenital scoliosis, vertebrae are abnormal. You ask the patient to bend forward, गायब नहीं होगा. If there is postural scoliosis, you ask the patient to bend forward, it will disappear, called as Adams forward bending test. Trendelenburg test is for hip stability. Drop. If you stand on the right side and the opposite side drops. देखो, scoliosis is lateral curvature बेटा. अगर आप पेशेंट को आगे झुका दो तो ये postural scoliosis है. गलत जगह लिख रहा हूं बट इंपॉर्टेंट है, ये postural scoliosis. ऑलराइट, और ये डिसअपियर नहीं हो रहा. Idiopathic या फिर कंजेनिटल, यहाँ पे फिक्स्ड है बेटा, विद द पोजीशन दैट इट विल नॉट चेंज. इफ यू बियर द वेट ऑन वन साइड एंड द अपोजिट साइड ड्रॉप, मींस जिस पे आपने वजन डाला वो खराब है. क्या खराब है? स्टेबलाइजेशन ऑफ द हिप. हिप की स्टेबलाइजेशन किस पे डिपेंड करती है? नॉर्मल हिप, ग्लूटियस मीडियस मिनिमस एंड सुपियर ग्लूटियल नर्व. दिस इज ट्रेंडलनबर्ग टेस्ट. Alright. Thomas test is for hip flexion deformity. These are two very important things. Tarun, please videos play कर दोगे? मैं आपके पास करूँ. I just want you to see these two videos, right? It will give me a second to have water also. यार बड़ा कमाल की एक बात है. पेपर लीक कहाँ आता है यार करना हमारे ऐसे बंदों का. चलो देखो. Let's assume this is a young man and he has a hip flexion deformity. So the angle between the table and the hip is the deformity. All right. And I can't straighten it. It can't straighten out because it's a deformity. Now, a person cannot keep the hip deformity like this. So he will hide the deformity. Hiding means conceal the deformity. So how will he conceal the deformity? He will try to increase the lumbar curvature. इसको ऊपर करिए. इसको ऊपर करिए. पैर को सीधा कर लीजिए. So he has increased the curvature. As he has increased the curvature, you can see this has increased lumbar lordosis. How much is the lumbar lordosis? Lumbar lordosis is the same as the deformity. So it can conceal or hide up to 30 degrees of deformity. So when we do the Thomas test, the number one thing we see is there lumbar lordosis? If there is lumbar lordosis, it means your pelvis is trying to compensate by increasing the lumbar curvature. So number one step, go in and check the lumbar lordosis. If you can slide your hand, it means there is increased lumbar lordosis. So you have to block it. My left hip is diseased. My left hip is diseased. So what I will do is, I will ask the patient to flex his right hip. So the moment I flex his right hip, this rotation of the pelvis will go away and the lumbar lordosis will be blocked. What I will request the patient is, I will flex his opposite side. So I will flex his opposite side and ask him to hold it. The moment he holds it, his lumbar lordosis goes away. My hand cannot slide. Now it's blocked because the pelvis is derotated. So it's blocked, but his deformity comes back. So the first step, check for the lumbar lordosis. Second, block or obliterate the lordosis. Block it up. Third, you can see the deformity, right? Sometimes it is stretched too much. Just check, is it stable? So it's stable. And then you can see the angle between the table and the thigh. That is the deformity. Thank you. Now we will see the Trendelenburg test. So you can see this is a person. This is a person standing on both the limbs and body weight is equally transmitted. But human hip is a very strong structure. You can balance your body on the one hip if that hip is normal or its abductors, that is gluteus medius and minimus are normal, or the superior gluteal nerve of that side is normal. So let's assume that in this particular person, his right side is normal and his left side is not good. So right side is good, left is not good. All right. So we will ask him to stand on the right lower limb. So right पैर पे आप खड़े हो जाइए. All right. So when I see that he's standing on the right leg, his left leg is in the air, and the left side of the pelvis is straight. It is not dropping. So left side नीचे नहीं गिर रही. Fantastic. बहुत बढ़िया. Why is it not dropping down? Because the right hip is normal. On the right side, the abductors are normal. The hip is normal, and the nerve supply, the superior gluteal nerve for the abductors is normal. So right side, you bear weight. Left side, it does not drop. When it does not drop, it's negative. So normal is negative. What does not drop? The opposite side. This is a normal scenario. Now he will bear weight on the left side. Left side is diseased. So please stand on the left side. You will see when he stands on the left side, he is not able to keep it straight. It drops on the right side. Why? Because the left side, gluteus medius, minimus, the nerve supply, the superior gluteal nerve, all the hip is affected. So the right side drops. So the mnemonic is drop on the opposite side is positive. So normal is negative. The opposite side will not drop, right? But when it's disease, the opposite side will drop. Thank you. Thank you. Thank you. Thanks a lot for giving me a break. All right. This is the only time when I can take a break in this class. Sharing कर दिया. ब्लैक शर्ट इसलिए पहनता हूँ बिकॉज काले पे कोई रंग नहीं चढ़ता. जो बदल गया वो इंसान क्या. भाई when I get out from my room in the morning, na, it's 4 o'clock. I start operating at 4:30. All right. So my daughter and my wife are sleeping there. तो चुपचाप एक शर्ट निकाली पहन ली. सारी एक जैसी होंगी, टेंशन नहीं है ना क्या पहने. ठीक है. चलें आगे. तरुण आजा, जैसे मिलना नहीं यार. दे वांट टू. तरुण तो हमेशा ही होगा यार. सब नमस्ते करो तरुण को. हार्ट्स फॉर हिम. सेरेबेलम की नींव है ये लोग. टीचर्स आते हैं और बोल के चले जाते हैं. ऑलराइट. दीज आर द रॉन्ग. दीज आर द स्ट्रॉन्ग पिलर्स. राइट. और आप लोग सारे दिल देखो, ये होते हैं हार्ट्स. देख तरुण, इन्हें कहते हैं दिल. साला 4 बार मुश्किल से बहा रहे थे मेरे लिए. अब तो पूरी गंगा बहा दी उन्होंने. वाह, मेरे लिए 2 बूंद. चलो आगे बढ़ते हैं. राइट. इंटर ट्रोकैंट्रिक का मतलब होता है बिटवीन द ट्रोकैंट्रिक बोन्स. इट्स एन एक्स्ट्रा articular extracapsular fracture, right? And here it's extra pain, extra swelling, extra shortening, extra externalization, everything extra. And it undergoes malunion. It never undergoes non-union. Neck of femur is again extra articular but intracapsular, less than 45 degrees external rotation. Remember, in neck of femur, avascular necrosis is more common than non-union. स्टेफॉइड में उल्टा है. नॉन यूनियन इज मोर कॉमन देन एवियन. इस इमेज को आपको नहीं पता. हिप के डिस्लोकेशन पोस्टीरियर मोर देन एंटीरियर. sciatic nerve palsy occurs in posterior dislocation, long term complication osteoarthritis. Tibial pylon, lower end tibia का fracture, FMG favorite, is called as intra-articular fracture of lower end tibia. Talus fractures can cause osteoarthritis of subtalar joint between talus and calcaneum. एंड कैल्केनियम के अंदर 2 एंगल चेंज होते हैं, बोलर एंड गिजेन. बोलर्स, लोअर्स, गिजेन, गेन. 3 एंगल्स याद करना. कॉप्स फॉर स्कोलियोसिस, बोलर एंड गिजेन फॉर कैल्केनियम. राइट. दीज आर इंपॉर्टेंट. Kites angle, kites for the man who really worked on CTV. So kites angle for CTV or clubfoot. When you are immobilizing the fractures, these images can come to you. Hanging cast for humerus, H for hanging cast humerus. Similarly, U slab भी होता है for humerus fractures. All right. For patella, it's cylinder cast, also called as a tube cast. Right. Then you have patellar tendon bearing cast for tibia. मुझे ऐसा लगता है क्वेश्चन आएगा. Hand shaking cast for Colles and glass holding cast for scaphoid. Scaphoid का proximal pole undergoes AVN. Remember that. Gallows traction is for fracture shaft of femur less than 2 years of age. Not to be preferred. आज की दुनिया में you usually give spicas. Cock-up splint, radial nerve palsy is dropped. Cock-up splint, most commonly are splint in the human body. Knuckle bender splint for ulnar nerve more than median nerve. Figure of 8 for clavicle. Dunlop or Smith fraction for supracondylar fracture humerus. Remember, Smith fraction is not for Smith fractures. Dennis Brown splint for CTV or clubfoot. Agnes Hunt is for flexion deformities of the hip. Russell's for intertrochanteric fracture. When there is a shallow acetabulum and there is a small epiphysis and the hip dislocates, that's called as developmental dysplasia of hip. At birth, you pick it up either by right alto lani means hip ko andar lana wala test or bahar low test, right? And you maintain the hip abducted. So अगर hip को abducted रखोगे तो वो ठीक है. Pavlik harness or bacillus cast. When you have scoliosis, you give Boston brace और Milwaukee brace. Milwaukee brace बेटा chin तक जाता है, mentum तक जाता है. Boston brace बेटा breast या axilla तक जाता है for scoliosis. These are congenital scoliosis की variety, not a normal skeleton. तो ये रहा Boston brace, breast तक गया. So Milwaukee brace ये रहा Boston brace, Ash brace ऑस्टियोपोरोसिस के लिए. टेलर स्पाइनल ब्रेस कंधे तक जाता है और डोर्सोलंबर एरिया. This is something that almost always comes to you in the exam. Brand's triangle, again, FMG special question is for supratrochanteric shortening. Above the trochanter, that is head or neck damage होगा तो उसको measure करते हैं. If there is a compression of a nerve due to disc prolapse, it's called as sciatica. Back pain going down the limbs. Orthopedic, whenever they ask you investigation, mark MRI. Most common disc prolapse is L4, L5. Between L4 and L5, and the nerve root compresses L5. That's the commonest nerve root compressed. Remember, compression neuropathies like carpenter syndrome or disc prolapse are treated by rest plus NSAIDs. If not relieved, local injection of steroid, if not surgery. से plan A कहते हैं, नाम हमने दिए. Just to remember, L4, L5, S1 क्या supply करता है? L4 supplies tibialis anterior and medial part of the foot. L5 supplies the extensor hallucis longus, मतलब great toe को ऊपर ले जाना, and the dorsum of the foot. Dorsum of foot. And S1 supplies flexor hallucis longus for पैर को. मैं हाथ पे दिखा रहा हूँ पर पैर को. Flexor hallucis longus और ankle plantar flexion. Ankle reflex S1 होता है बेटा. And sole of foot. तो सबसे common nerve root which is compressed is L5 nerve root. FMG में पूछते हैं which is the most common, right? L4, L5. Spondylolisthesis, slip of one vertebra over the other. It occurs between L5 S1. हमने hangman पढ़ा था, वो भी spondylolisthesis था. Spondylolysis, spondylo vertebra का break in the area of pars interarticularis occurs at L5 vertebra. So L4, L5, disc prolapse. Spondylolysis L5. Spondylolisthesis L5 S1. ऊपर से नीचे. In spondylolysis, if you do an oblique or lateral view of the spine, आपको एक dog दिखेगा, उसकी neck में break दिखेगा. Dog with a collar in the neck. In spondylolisthesis, it's a beheaded Scottish dog. Scottish dog बड़े बढ़िया होते हैं, तो beheaded Scottish terrier sign. All right, osteoarthritis occurs in the distal interphalangeal joint. Knee में medial side में pain होगा. Hand का base का first carpometacarpal joint होगा. Osteoarthritis में genu varum होगा. The distal part goes towards the midline. Most commonly wasted muscle होगी quadriceps. In osteoarthritis, if the activities of daily living are affected, you operate. If you can correct the deformity in less than 60, इसे बोलते हैं हाई, मतलब ऊपर टिबिया को काटना, हाई टिबियल ऑस्टियोआर्थराइटिस. और अगर 60 से ऊपर है पेशेंट, डू योर टोटल नी रिप्लेसमेंट. ऑल्सो रिमेंबर वन मोर थिंग, देन इन ऑस्टियोआर्थराइटिस, राइट, ऐसे याद कर लेते हैं. बोल ओए, व्हेन यू से ओए, देखो क्या हुआ, थंब ऊपर गया तो थंब का बेस इन्वॉल्व हुआ, फर्स्ट कार्पोमेटाकार्पल. ओए, सो डीआईपी एंड पीआईपी आर इन्वॉल्व. ओए, जल्दी खत्म कर दे, क्लास आगे पढ़नी है साइकाट्री. ओए, तो डीआईपी पीआईपी नॉट. बोलो आर ए आर ए आर ए. द टू जॉइंट्स टुवर्ड्स यू, that is MCP and PIP are involved. RA. DIP is not involved in RA. Remember that. All right. So RA, DIP is paired. MCP most common. Knee में genu valgum. The distal part goes laterally. Valgum knee lateral. Swan neck and boutonniere deformity is there. We'll just see them in ulnar deviation of finger. Sacroiliitis, young male, decreased chest expansion, bamboo spine. That is Ankylosing spondylitis. So sacroiliitis is diagnostic. It is radiographic, MRI proven sacroiliitis, which is diagnostic. So you have bamboo sign, you have dagger sign, the interspinous ligament, they look like a knife, or there is calcification all around the facet joints, called it polytract sign, or shining corners of the vertebra romanes sign. All of them are seen in ankylosing spondylitis, right? Mycetoma is a painless condition, subcutaneous infection called as dot in the circle sign. All right, so this is Madura foot that occurs around the jaw is actinomycosis. Charcot's, another painless condition seen in diabetic patients, midfoot joints, loss of proprioceptive fibers, destroyed joint, right? Damage anatomy seen in diabetics. So Charcot's and mycetoma are painless conditions. The most common presentation in orthopedics is pain. That is why painless पूछते हैं, right? Red hot great top in a middle-aged businessman because of alcohol intake and non-veg intake is gout. There is uric acid crystals, which are needle-shaped. When you throw a light on them, the light goes on the left, called as negatively birefringent, right? Whereas pseudo-gout, calcium pyrophosphate crystals. Hi, Tarna, I'm in the class. Yeah, I'm a class. I am in a cerebellum marathon session. Taruna, my wife is wishing you all the best. Tarun मेरे को क्लास कराता है, तरुणा विश करती है आपको. Okay, so I'll be getting free in 30 minutes. Yeah, after the OPD, I'll talk to you. I will get it done today. Thank you. Bye. When there's a call from the Home Ministry, nobody can refuse. Show off नहीं कर रहा. That's the way to live life. Right? So I'm sorry, मुझे माफ कर देना. गलती हो गई, right? खानदानी अब नहीं करूंगा. So grade 2, gout, middle-aged businessman. Pseudo gout, calcium pyrophosphate crystals. They are rhomboid shaped. They are positive reference seen in hypothyroid. Last year, 2025 NEET, they asked you this. Rickets can be calcium, vitamin D deficiency. There is widening around the joint. You give calcium, a white line of Frankel is seen. This is called as healing rickets. रिकेट्स में कपिंग होती है, एक शेप है, चौड़ा होता है, एक स्प्ले और एक फ्लेयरिंग है. डिस्टल पार्ट्स गोज आउट. So cupping, splaying, and flaring occur in rickets. Rickets will usually have normal to low calcium, decrease phosphate, except renal rickets, which is going to be high PTH, except hypophosphatemia and high ALP. In hypophosphatemia, the PTH is normal. All right. Scurvy, vitamin C deficiency. There is whitening. Rickets is widening, scurvy is whitening. So there is Wimberger ring sign. Epiphysis sclerosed. And white line of Frankel हमेशा होगा, always. Rickets में only in healing, here it's always there. Windswept deformity. One knee into valgus, the other into varus. All right. Hyperparathyroidism. Bone में गड्ढे होते हैं, filled with blood, gives it a brown color called as brown tumor. Bone resorption disorder. Only condition where you have high calcium is multiple myeloma and primary hyperparathyroidism. All right. You will have salt, pepper, skull. In chronic renal failure and osteopetrosis, you can have alternate bands on the vertebra called as rugger jersey spine, like rugby के players की jersey होती है. Bone weakness is osteoporosis measured by DEXA scan, dual emission X-ray absorptiometry. You calculate T-score on it. When T-score is less than -2.5, it's called as osteoporosis. The vertebrae, right, are compressed, and the disc looks like a fish called as swordfish vertebra, which is seen in osteoporosis more than osteomalacia. More than 65 years in females and more than 70 in males, you screen the bone for osteoporosis. Paget's is an osteoclast defect. Most common symptom is pain. Most common area affected is pelvis. The vertebra looks white, called as ivory vertebra. In the skull, there is a cotton wool deposit. Osteopetrosis, again an osteoclast defect, you will have rugosid spine, and the bone does not have a marrow. मैरो जड़ है सारी बीमारियों का, सो वो है ही नहीं, सो अलग बीमारी है, मार्बल बोन डिजीज. फ्रैक्स स्कोर इज अ फैसिलिटी स्कोर डन इन ऑस्टियोपोरोसिस. Collagen, one defect is osteogenesis imperfecta. All right. If you have a limb crushed, you want to know about the survival, MES score is done for it. If the score is more than 7, it indicates the patient will undergo an amputation. The 4 parameters in MES score are, right, shock, ischemia, velocity of trauma, and age of the patient. Total score is 11. When you have a limb which is amputated, जैसे द्रोणाचार्य ने बोला, राइट, कि तुम अपना अंगूठा जो है मुझे काट के दो. तो अंगूठा काट के जब दिया गया, तो वो अंगूठा लेकर, राइट, छात्र वापस गया कि इसको वापस लगा दो. तो द फर्स्ट स्ट्रक्चर टू बी फिक्स्ड इज बोन in the reimplantation, called as bone, then extensor tendon, then flexor tendon, then artery, nerve, vein, and skin. First to preserve is skin, but repaired last. Amputations, if it's above the knee, it's above knee. When below knee, that comes as a question. All right, above elbow or below elbow. सबसे common amputation है below knee. Right? जयपुर फुट, अगर आपने किसी का एम्पुटेशन किया है तो आप आर्टिफिशियल लिम्ब लगाएंगे. अगर वो हिंदुस्तानी है, इंडियन है, यू विल गिव अ नेचुरल लुकिंग फुट which will allow the patient to sit on the ground and uneven surfaces. Sag foot is artificial looking. You can't square and can't walk barefoot. In the knee joint, because of the rotation, that is twist on a flexed knee, the menisci are damaged. Menisci are the fibrocartilages. The medial meniscus is fixed to the capsule, that's damaged more than the lateral meniscus. The blood supply of meniscus is from out to in. So outer zones are repaired. जिसमें blood होगा वो heal होगा. The inner is avascular, will be torn. The anterior cruciate ligament is the most common reconstructed ligament in human body. It will be damaged with a valgus force along with rotation. ACL के दो fibers होते हैं, anteromedial which works in a flexed knee, posterolateral that works in extended knee. So हम ऐसे याद करते हैं, posterolateral works in extended knee. Remember the mnemonic, plead. So the test for ACL are pivot shift, Latchman test, which is the best test because ACL. Then you have the anterior draw test. And एक नया टेस्ट आया है, लेडी टेस्ट. नाम ही अजीब है उसका, पता नहीं एमबीबीएस में हुआ क्या होगा. ऑलराइट, सो दिस इज प्लीड निमोनिक फॉर एसीएल. ऑलराइट, पीसीएल प्रिवेंट्स एक्सटर्नल रोटेशन. इसके लिए जो टेस्ट होता है उसका नाम होता है डायल टेस्ट. ऑलराइट, so this is for the PCL. Most common tendon to damage in the human body is supraspinatus, followed by biceps, followed by tendoachilles. बाइसेप जब टीयर होता है तो एक पॉपाई बनती है कि इमेज आती है हमसे. Most common ligament to damage around the ankle is anterior talofibular ligament on the lateral side. This will get damage on inversion injury. Whereas deltoid ligament is damaged in eversion injury. Right? If you have a ball, ऐसे गया, and it goes into abduction. ऐसे बॉल आई, थंब को ऐसे गिरा दिया. Ulnar collateral ligament of thumb is damaged, called as gamekeeper's thumb. If there is avulsion of extensor tendon from distal phalanx, it's called as a mallet finger. Very commonly asked MCQ. Splint is given for treatment. When FDP avulsion is there, this is jersey finger treated by surgery. Right? In the knee joint apparent, you have Medical College Lucknow Medical College. So anterior to posterior, these are the structures. That is anterior horn of medial meniscus, anterior cruciate ligament, anterior horn of lateral meniscus, posterior horn of lateral meniscus, posterior horn of medial meniscus, और सबसे पीछे होता है पीसीएल. सो डैशबोर्ड में अगर आप स्ट्राइक करते हैं, ब्रेक लगती है गाड़ी में, एंड योर नी गोज इनटू डैशबोर्ड, if the force goes into tibia, PCL is a burst. If the force goes into femur, the posterior dislocation of the hip occurs. So dashboard injury is posterior dislocation of hip more than PCL. So this is anterior part of medial meniscus, ACL, anterior part of lateral meniscus, structures on the upper end of tibia, anterior to posterior. Posterior part of lateral meniscus, posterior part of medial meniscus, PCL. मेडिकल कॉलेज लखनऊ, लखनऊ मेडिकल कॉलेज. तो पीसीएल सबसे पीछे होता है, एंड दैट गेट्स डैमेज इन डैशबोर्ड इंजरीज. बट अगर आपसे पूछा जाए डैशबोर्ड इंजरी होती क्या है, पोस्टीरियर डिसलोकेशन है मोर देन पीसी. ये बात याद रखना, दोनों एमसीक्यू आते हैं. अगर डायबिटिक पेशेंट में शार्कआउट वेन होता है, तो डायबिटिक पेशेंट में शोल्डर भी फ्रीज करता है, एंड पेशेंट हैज डिफिकल्टी इन राइट राइट पीछे जो है हाथ जाने में. इट इज कॉल्ड एज adhesive capsulitis, and treatment is rest plus NSAIDs if no relief, local steroid if not surgery. If you have inflamed tendons, first 60 degrees of movement of the shoulder is okay. 60 to 120 is painful, called as painful arc syndrome. Treatment is plan A. In tennis elbow, you have inflammation of the lateral epicondyle, called as lateral epicondylitis. Here, the extensor carpi rectus brevis is more inflamed than longus, and there's a test called as Cozain test for it. In golfer's elbow, there's medial epicondylitis. Student's elbow is olecranon bursitis. ये MCQ आता है. Housemaid's knee is prepatellar bursitis. Clergyman's knee is infrapatellar bursitis. Lateral division of great toe is hallux valgus. This image comes. At birth, shallow acetabulum, unstable hip, DDH, painless. Age group 4 to 10, avascular necrosis of the femoral epiphysis, painless, Perthes disease. Investigation of choice, MRI. दोनों DDH and Perthes maintain hip abduction. 11 to 20 years, hypothyroid, obese patient. The epiphysis slips from the metaphysis, slipped capital femoral epiphysis, painful. Reduce and fix. All right, these are very, very important. The most important movement of any ball and socket joint is internal rotation. अगर hip या shoulder खराब होगा, the first movement to go is internal rotation. Club foot or CTV, right? There is cavus, adduction, varus, equinus. This is opposite of CTV, rocker bottom foot. छोटे बच्चों का खिलौना होता है, उसमें रॉकर की तरह रॉकर बॉटम में घूमते हैं, रॉकर बॉटम. राइट. इफ यू डू नॉट करेक्ट CTV इन द ऑर्डर ऑफ केवस, मतलब इंक्रीज प्लांटर आर्च, एडक्शन means the foot deviating in, varus means the heel deviating in, equinus means the plantar flexion. If you do not correct in this order, they will be rocker bottom foot. All right, that's all. This is all I wanted to speak to you. Right? Do remember to see my lab 1, lab 2 classes. Do remember to go to PDF. They're all in the same sequence. Do remember to attempt your paper with heart. The rule of entrance is very simple. Right? The rule gave us then adduction, then varus, then equinus. Aslam Saab. It is very, very important to remember. Let's kill it. Let's have a feeling. Start. Important topics, important चीजें आनी चाहिए. So do remember to revise 19 subjects, important key points. Middle segment, do not lose any hour. And the slog, last 2 days, feel होगा, belief तो रखो, is very important. Commitment is getting up at 9 and be ready for the class. Hard work is studying till 11 in the night. And surrender to God is trust the process. This man told me one thing. Respect your dreams. They should scare you. Right? Draw a plan for the next day before you sleep. तेरी किस्मत दा लिखा तेरे तो कोई खो नहीं सकता. तू श्रम करा चल बंदे. जो उसकी मेहर हुई तुझे वो मिल जाए और तेरा हो नहीं सकता. So remember, if you deny the given, if you defy the given, यू कैन रीराइट योर डेस्टिनी। आज से 30 साल बाद ये अफसोस नहीं होना चाहिए कि 10:15 पे, राइट, एक व्यक्ति 19 जून को हमारी आंखों में आंखें डाल के बोल रहा था, जान लगा दो, ये समय फिर से नहीं आएगा। अगर हम सुन लेते तो आज हम वो होते जो हम बनना चाहते थे। See you all in cerebellum. This is the last exam, right? Which you will be competing with the computer, not against each other in life. Best of luck. Thank you very much. Bye bye.